Hey everyone, I just want to start by saying I really appreciate you taking the time out of your busy days to watch this video. I'm going to try to keep it as short as possible, but I'm also really looking forward to hearing your feedback. Basically, what's happening is I've been experimenting with some different variations on adjusting. I do coupled adjusting, and I've been doing things in a slightly different way, and it seems to be working and doing some very, very interesting things. And I want to just explain what it is that I'm doing and why I think I'm getting the results that I'm getting. So I'd love to hear your feedback on this. Basically, what I'm doing is I'm adjusting, if I'm adjusting a joint, rather than adjusting the joint at the end range of the motion, even though I'm doing coupling, what I'm doing is I'm actually adjusting the joint and finishing the joint at the neutral position. So it seems a little bit bizarre. It seems like it shouldn't work, but it's working, and I'm getting some really interesting results. So it's essentially, just as a quick explanation of what the adjustment is it's, say for instance, if a joint isn't laterally flexing to the right or rotating to the right, we would typically take it quite far to the right and then adjust at the end range. What I'm doing in that sort of circumstance is actually, because the muscles are restricting it from going to the right, if I move it to the right, I'm going to be able to get the appropriate stretch and the appropriate afferentation in the joint that I want. So there's nothing that says we have to adjust it at that end range. So what I'm doing is actually supporting the joint in say, a left rotation and left lateral flexion, and adjusting in exactly the same way, same contacts, but finishing the adjustment at the neutral position. So in other words, I'm only moving from here to straight. It doesn't sound like it works, but I've found a way to make it work, and but the results I'm getting are really very intriguing, and I'm trying to understand whether my thinking is correct, and I really want to get some critique from the community about why I think it's working. What's happening is I'm adjusting people, they're coming back in a week and 2 weeks, and the issue isn't there anymore. And there's a few thoughts I have about why that's happening and why it's working. There's two components that I'm using in the adjustment. One is the fast stretch, and then I'm also doing a slow stretch as well. But what's happening is, what I think is happening is that when we're doing the adjustment, rather than when we do an adjustment at the end range of motion, there are not as many mechanoreceptors at that end range because our joints aren't used to being at that end range. So in the center or in the neutral position is where we're going to have the most mechanoreceptors. So what my thinking is that, for one, I'm probably getting a stronger stimulation in a sense, because I'm actually adjusting the joint into the neutral position. So there's more mechanoreceptors through that motion of the adjustment itself. But as we all know, the significance of what happens in adjustment is what's happening afterwards. Increased frequency of firing due to the joint moving better. But what I think is happening as well is that, because I'm adjusting and finishing the adjustment with the joints in a neutral position, then I'm actually showing that short muscle that I'm stretching exactly what length I want it to be. So when I finish at that neutral position, I want that muscle to just stay there. If I were to adjust at the end range of motion, I'm really loading it before I stretch it. It's going to decrease the tone of it, but how do I know how much is going to decrease that tone? Is it going to be decrease the tone by too much and leave that muscle too long? In which case I'm going to find something else the next time I check them. Or is it just not doing enough? We might be just making small incremental differences. I don't know. But when I'm adjusting this way, what's happening is I adjust it. It's at that length. I have good mechanics of the joint straight away, and the adjustments are holding. So that's the first component. That's that sort of fast stretch aspect of it. But then what I'm doing is I'm following it up with a slow stretch, and I can explain how I'm doing it. But I'm basically moving that joint after I've gotten the intrinsic or the deeper muscles to relax. What I'm doing is I'm doing a long, very, very slow stretch on the other extrinsic muscles that would be limiting that whole aspect of motion. So whether it's like right anterior and left posterior. So I kind of work the joint through that range, and then I take the joint and move it and stretch it so that I can make sure that joint, that every layer of muscle around that joint is going to be at the appropriate tone to not only stabilize the joint but get the joint to move, with strength where it needs strength, and also to be flexible enough that it can actually move. So that's kind of the second component of that. But in that, the way that I'm doing that stretch, what I do is I have people close their eyes when I'm doing it. So, and I do it very, very, very slowly. So the reasoning behind that is that we have motion and position sensors. We know this when we talk about the vestibular system, but also in the joints we have, the spindles that are sensing that motion, and the load or that position on the joint is the Golgi tendon. So if I'm moving the joint at a certain rate, your vestibular, you're moving your head obviously as well. So typically, and so when you're moving the head, then what's happening is you're getting some vestibular component. But if I move it at a slow enough speed, we know that we can bypass that stimulation of the motion sensors and be biasing position sensors. But also, because I have their eyes closed and I'm moving the joint, they don't know where they are. They're relying on that sort of utricular or that otolithic position sense. But at the same time, as I'm holding the joint, they become aware of the joint, obviously, because we're stretching muscles. There may be some tight muscles there. But as I'm moving that joint, I'm moving it through the coupled range of motion. At the same time, I'm stretching the muscles. So what's happening is I do it very, very, very slowly. So I know that the threshold on motion in the joint is much more sensitive than the vestibular system. You have to move it much, much, much slower, so they can't feel it. But if they can't feel I'm moving it so slowly they can't really feel me moving it, then what's going to happen is the brain is going to focus its attention on position. There's no motion input, or very, very low threshold, and we have our position of our our vestibular, our utricular or otolithic information. We have our position sense of the joints. So I think that is actually working like a recalibration maneuver. So when we're doing like a barbecue roll or something, I think that there might be some aspect of that's happening. We know that that's happening. We know that you're recalibrating your position sensors and your otolith. But I think that when I'm doing this and actually working still through that same joint, that's actually allowing my joint, or the joint that I'm working on, to experience the proper coupled motion. And again, this is after we've already balanced out those intrinsics. We're just working through that extrinsic, and once your body feels and it can be guided through that motion, it's like I'm creating that stability, so your body doesn't feel like it's unstable, and I'm moving the joint through its range of motion until I feel that muscle lets go, and they just melt. So after I check the neck, it feels stable and it's moving, and they come back a week or two later and it's still working. So that in itself is fun. I'd love to sort of share more about what I'm doing with the adjusting. But the thing I really want to get critique on is to get a little bit of feedback of whether that reasoning sounds solid to everyone. And if you can all just sort of chime in and give me a little comment or give me a call or something, I'd love to hear your feedback. So again, thanks for your time. I try to keep it as quick as possible. Sorry if I talk too fast, but I really appreciate your time and look forward to your feedback. Thank you.